Here in LA, probably one of the most important things that we talk about with patients who come in regarding any facial issues is sun damage. We get a lot of sun here. People used to bake a lot. Thankfully, they're a little bit more thoughtful about this now. The sunscreens are becoming a little more effective. But let's talk a little bit about exactly that, sun damage, what can be done.
Thankfully, we've come a long way. When we were kids, there were people still sitting out with tinfoil and baby oil. Things have changed, but I think there's still, for many people, kind of a lack of awareness of just the casual exposure you get day to day, walking around here, driving your car, those kinds of things. It's not just going down for a day at the beach. And our first conversation with all of our patients is primarily you want to start with sun protection.
So whether that's sunscreen or hats or coverage of any sort, hopefully in the not too distant future the FDA is eventually going to approve some of the newer blocking agents that are very effective, that are approved in some of the European skincares that we are not privy to yet here. But once you do have some signs of the leathery skins or the mottled skin, the pigmentation issues, the aging quality, what can be done?
Yeah, for those inevitable brown spots, red spots, the dyschromia, the discolorations, thankfully there's some really good treatments available. A lot of them center around first skin care, getting on an exfoliant, something that's going to help strip the superficial layers of skin, like a retin-A or an alpha hydroxy acid. We really recommend that all our patients be on something like that, because it's not only going to help to improve some superficial skin changes, but it's also going to get you a lot more benefit from lasers or any of the other treatments available to help with some of the deeper sun damage.
Yeah, so the next issue or the next line is sort of the laser treatment. IPL is very effective. For a lot of people, you know, if you've had IPL, it may not have been as effective as it needed to be. There is an art to that. There is differences between the different laser companies, as well as just the comfort level of who's doing the actual IPL treatments. Are they comfortable with your skin type, making sure that you don't burn? And occasionally, it's not enough to just do IPL. If you've got a lot of sun damage, if it's been sort of years and years, sometimes you have to do a combination, sort of what we like to call a superfacial, where you combine the IPL with a 1540 fractionated laser. Sometimes that's what's necessary to kind of break through.
Yeah, it's really important. I think that combined treatment makes a huge difference for people who have advanced sun damage, not just the brown and the red, but a lot of the laxity, the kind of change in skin quality that comes along with that leathery surface you talked about, some of the cobblestoning in the skin. They can get a huge improvement with a number of treatments. And again, like we said before, it's more than one treatment. You've been working on this a long time. You typically need a series of at least 2 or 3 treatments to make a really meaningful result. And then once you get to that place, we recommend coming back for maintenance treatment, usually once every 6 months or so.
Yeah, so really important, if you've had IPL before, don't be dissuaded. It doesn't mean that IPL is not for you or it doesn't work. Sometimes you do have to do something a little bit different. The fractionated laser in combination with IPL really does wonders for it.